Some restaurant owners say the increase from 25 to 50% indoor dining capacity might not even help all that much once it's too cold for outdoor dining. They say they are still asking for the data behind the decisions and say as of today, they haven't seen anything concrete. Fox 43 Finds Out gives you a glimpse of what we know and what we don't know when it comes to COVID-19 in restaurants.
50% is probably sustainable for many, sustainable for a lot. That will help. That will definitely help the situation.
John Longstreet, the president of the Pennsylvania Restaurant and Lodging Association, says Governor Wolf's latest announcement about restaurant capacity is a step in the right direction. Under the current 25% indoor dining restrictions, there were estimates that 7,500 Pennsylvania restaurants could close and 200,000 people could lose their jobs.
Do you think at this point that even with the 50% capacity, we're still going to see a significant number of restaurants close permanently in Pennsylvania?
There's no doubt.
What he says is hard for the industry is that it hasn't seen any solid evidence that restaurants are contributing to the spread of COVID-19 here in Pennsylvania.
We went into this with the concept that science would drive the decisions, and then that seemed to have gotten abandoned along the way.
A recent study by the CDC found adults who tested positive for COVID-19 were approximately twice as likely having reported dining at a restaurant than those with negative test results. Likely because people can't wear a mask while eating or drinking. That study looked at people in about 10 states, not including Pennsylvania. Still, State Health Secretary Dr. Rachel Levine says the Commonwealth does have enough data to make the decisions. Between July 13th and September 5th, there were 44,830 new COVID-19 cases in Pennsylvania. Through contact tracing, the Department of Health says a little less than half of those cases answered questions about what they did the 14 days before they tested positive. Of the people who did answer, less than 6% said they went to a restaurant.
And it doesn't say they got it from the restaurant.
At this point, the Department of Health has not provided or confirmed any evidence to prove that's where those people actually contracted the virus. A spokesperson did give us some data related to COVID-19 transmission from bars. Fox 43 Finds Out was sent an email that read, one bar was a shared point of potential exposure for customers and employees in at least 4 different counties. Another example is a bar that was visited by 27 cases in one county, and cases then also spread to a nearby county. We then asked for dates and locations of where that happened and if they had any similar data for restaurants. Those questions weren't answered. However, a spokesperson said the decision for dining capacity is not just based on contact tracing data.
Public health isn't looking at one specific thing, but looking at the entire picture. We may have some limited data on specific restaurant and bar information. We also have quantitative data. So the anecdotal information that we've gotten from essentially areas that took this action compared to an area that didn't take this action, and that scientific analysis to be able to look at what those case studies have shown and what those case studies then can translate to.
Fox 43 Finds Out asked several more times if specific data would be given to restaurant owners. That specific question wasn't answered with a yes or no.
We have more data than we have ever released on any disease ever.
It's frustrating to us, and it's frustrating to organizations like yours that have been trying diligently to obtain the data too.
We also asked the Department of Health if there is any metric that needs to be met in order for the state to feel comfortable reopening things to the way they were before COVID-19. A spokesperson said while there isn't really a magic number, a less than 5% rate of positive cases would be a key indicator. First, though, she said, we need to see how that 50% capacity will work starting next week. And we know there are a bunch of questions when it comes to that capacity. So we have answers on our website, fox43.com. And if you have a story you want me to look into, Fox 43 wants to find out. Let me know. Send me a message on Facebook or shoot me an email at fox43finds@fox43.com. Restaurant owners in Pennsylvania say they have not been able to see a lot of data related to why indoor dining capacity at restaurants is capped at 25%. While some other states have been able to link some COVID-19 outbreaks to bars and restaurants, Pennsylvania has not released any specific data on that here in the Commonwealth. Contact tracers are asking more and more questions, though, to get a better picture of what's really happening here in South Central PA. However, restaurant owners believe there still isn't enough information to justify those capacity limits. As Fox 43 finds out, some restaurant owners say they have no idea how they'll survive the rest of the year with those restrictions in place. There are a lot of empty seats inside of Mick's All-American Pub in Lancaster.
No, there's no possible way we'll be profitable this year.
The owner of that restaurant says the current COVID-19 capacity restriction on indoor dining is not making it easy to do business.
It's very hard for a restaurant owner to be at 25% capacity when we walk into a grocery store or a big box store and see absolutely no capacity limits, many times no mask being worn.
Owens wants to see the cold hard facts behind the Wolf administration's decision.
If you want to reduce traffic fatalities, you don't limit how many people can be in a car. You make them wear seatbelts and you ask them to enforce the speed limits. Barriers, masks, those are the seatbelts in the restaurant industry.
And he's not the only one.
There is no science that shows that 25% is any safer than 50% if you're doing proper social distancing and face masking. But there is a lot of data that shows that restaurants will close at 25%.
John Longstreet is the CEO of the Pennsylvania Restaurant and Lodging Association. He says Yelp did a nationwide survey when it came to restaurant closures during the COVID-19 pandemic, and the numbers for Pennsylvania could be devastating.
That's 7,500 restaurants, roughly statewide. That number is a little low. Will not reopen. Happens to be about 30% of the total restaurants in the state.
If all of those restaurants close, Longstreet says 200,000 people in Pennsylvania's restaurant industry would be out of work. The ability to offer some outdoor dining has helped restaurants keep people employed and pay the bills for now, but not for long.
Once we get down into the 40-degree nights and 40-degree days, that's not going to be a viable solution for anyone.
The Pennsylvania Restaurant and Lodging Association wants indoor dining capacity to go back up to at least 50% and to get a look at the data that proves otherwise. Fox 43 Finds Out has also been asking the Department of Health for that data too. Here's what we've been told so far. Between July 13th and August 15th, there were 30,117 new COVID-19 cases. During that time, contact tracers began asking more specific questions about the types of businesses people visited in the 14 days before they tested positive. Only about half of those people actually answered those questions. And of those who did answer, only 864, or about 5.5%, said they went to a restaurant in the 2 weeks before getting COVID. Now remember, that just means those people visited a restaurant. At this point, the DOH has not provided any evidence to prove that that's where those people actually contracted the virus. The DOH data also shows that 88% of people who tested positive and did answer contact tracers during that time say they did not go to a business at all in the 14 days before testing positive. We emailed a Department of Health spokesperson asking if they're using this data to make any upcoming decisions about restaurant capacity. That question wasn't really answered, but they did email us back, writing, "In order to successfully reopen restaurants at 50% or fully, we need to remain vigilant about taking precautions, especially wearing a mask that covers our noses and mouths while around other people. This is an easy yet important action that has been shown by research to reduce the spread of COVID-19. So Fox 43 Finds Out then asked if contact tracers are asking people if they wore a mask in public the 14 days before they tested positive for COVID. Again, the DOH spokesperson emailed us this response. We do not currently ask questions regarding masking as part of our case investigations. It is important that as part of the case investigation process, we are able to get as much information as possible from the confirmed case as far as potential exposures, close contacts, where they have been, etc. Any question that may prevent a complete case investigation can hinder our public health response. So, of that 5.5% of cases over the past few weeks who said they went to a restaurant, we don't know if they wore a mask or not. That is what Owens says is so frustrating for restaurant owners.
There's been absolutely no science behind this.
The only way, unfortunately, that you can solve this problem is to figure out a way that restaurants can operate safely at a capacity where they can they can continue to employ people and be profitable.
The Department of Health also cited the White House Coronavirus Task Force report to Pennsylvania, which recommended continuing to limit indoor dining at restaurants to 25% capacity. Now, there is some legislation in the works, both federally and on the state level, that could help restaurants financially. So far, though, none of those bills have passed. If you have a story you want me to look into, Fox 43 wants to find out. Let me know. Send me a message on Facebook or shoot me an email at fox43findsout@fox43.com.